Hi friends, morning. I'm Dr. Ashutosh Gupta. For today, we are going to talk about a condition called as fetus in feto. Just to give you the background, the embryo is being formed in the fallopian tube. Okay, fallopian tube में form होने के बाद में, and then we believe कि the embryo gets into the intrauterine cavity और उसमें endometrium में जाके वो implant हो जाता है. So this is the normal circumstances, and therefore the fertilized egg or the embryo being formed gets into the uterus, and therefore intrauterine pregnancy is there. But in a rare of the rare conditions, what happens is this, that embryo which has been formed in the fallopian tube, instead of getting inside into the uterine cavity, gets aborted from the fallopian tube. ठीक है, तो उसको ट्यूबल अबॉर्शन बोलते हैं. तो अंदर आने की बजाय वो बाहर चला जाता है, और since it has got all the potential to invade, so meaning thereby जो embryo होता है उसकी outer layer होती है उसको ट्रोफोएक्टोडर्म बोलते हैं. So it has got all the potential to invade wherever it would get a good blood supply. So meaning thereby fallopian tube से निकलने के बाद इसको हम tubal abortion बोलते हैं. वो broad ligament. So these are two ligaments which stabilize the fallopian tubes on both the sides. उसमें वो mostly embed कर जाता है, and therefore it leads to the abdominal pregnancy. So we do have one good case in which we've identified at 10 weeks that probably we are having one pregnancy which is there in the uterus, and the second pregnancy which is there outside, right? So ये मैं आपको दिखा देता हूँ. तो ध्यान से देखिए, तो फर्टिलाइज्ड एम्ब्रियो जो है वो ट्यूब से बाहर आ गया, ट्यूबल एबॉर्शन और ब्रॉड लिगामेंट में इम्प्लांट हो गया. ये इंट्राउटेराइन प्रेगनेंसी है 10 वीक्स एंड 2 डेज की. सो वी कैन सी द स्पाइन, हेड एंड द लिम्स, राइट. सो ये इंट्राउटेराइन प्रेगनेंसी है. बट अगर हम बाहर देखें तो ये गट है. सो ये ऊपर जो दिख रहा है आपको 12 o'clock पे, सो दिस इज द गट, ये माँ की गट है. एंड देन वी आइडेंटिफाई समथिंग सिनिस्टर इन हेयर, राइट. एंड देन वी पुट द कलर एंड आइडेंटिफाई कि भाई इसमें तो ब्लड फ्लो भी है. सो मीनिंग देयर बाय दैट it becomes a baby which is there, it becomes a fetus, it becomes an embryo which is implanted simultaneously in the abdomen of the mother, right. And then we did the laparoscopy, and then we identified ki ye, now we are doing this laparoscopy, and then we are trying to remove this out. So ye broad ligament mein, so this is the area, this is that. So this gets implanted into the broad ligament, and since it has got the blood supply which is coming from the broad ligament, and therefore it keeps on growing, and therefore can lead to a lot of complications and all those stuff, right. So now what we are doing is this, that we are fulgurating the blood supply, and then probably we'll take it out. So this is what we are fulgurating. We are making it avascular, and therefore we'll take it out. And therefore, so this is a case in which we have had one pregnancy which was outside and second was inside. Fetus in feto, meaning thereby that the fertilized embryo has got the potential to develop at any place, and it has to travel. And in the meantime, if it implants anywhere, so if it implants in the tube, it becomes a tubal pregnancy. If it implants into the cornu, it becomes a cornal pregnancy or an interstitial pregnancy. If it gets into the uterus, it becomes a normal intrauterine pregnancy. But what happens, many of the cases, it gets aborted. It gets aborted from the fallopian tube and gets into the peritoneum. वो abdomen में आ जाता है, तो वो broad ligament में implant कर जाता है. Broad ligament is a hypervascular area of the mother, and therefore it grows. So this is what has happened in our case. So there were two embryos. एक तो अंदर आ गया in the uterus, and therefore we are having this intrauterine pregnancy, and the second one got outside, and therefore was surviving with the mere blood supply which was there in the broad ligament, and therefore we were having fetus in feto, meaning thereby that we were having two fetuses, two pregnancies going on simultaneously. One was in the uterus and second was outside. एंड फॉर एस्टोनिशिंगली, सिंस आपको ये पता ही है कि वो जो एक्टोपिक का जो पेन होता है वो तभी होता है बिकॉज इन द ट्यूब, जो फेलोपियन ट्यूब होती है वो एक्सपैंड करती है बिकॉज इन द बेबी इज ग्रोइंग. वो बिल्कुल भी नहीं होता है, राइट. एंड देयर फॉर दी, सो इट इज बाई sort of in very very sort of suspicion that probably we looked around into the adnexa and identify what exactly is happening, and we could identify that this was an secondary abdominal pregnancies going on simultaneously with a normal intrauterine pregnancy, right. And therefore, so probably it cannot continue like this, and therefore it can lead to a lot of complications, because it is going to extract the blood supply from the broad ligament or from the mesentery of the baby, and the baby would keep on continuing which is there in the abdomen. So this can lead to a lot of complications and hemoperitoneum, and the mother's life would be at risk. So identification and confirmation on TVS, and then we did a diagnostic laparoscopy, and then we took it out, right? This is how we have managed the fetus in feto pregnancy. Okay, thank you very much for your patience.